College of Pharmacy students at the College of Pharmacy at the University of Minnesota. This is a public service announcement about stroke awareness and stroke symptoms. Why do you need to know about this? Because 800,000 cases of strokes occur in the United States every year. A stroke occurs every 40 seconds in America. This video may save your life or the life of someone you love. Strokes usually come out of nowhere, and time is the single most important factor in how much the stroke impacts the rest of the victim's life. Getting immediate help can mean a short recovery. Not getting help in time has tragic consequences, from having permanent paralysis on one side of the body to complete paralysis. 10 to 20% of strokes are fatal.
Go.
Hello, I'm going to talk about stroke today. The first kind of stroke is called an ischemic attack, and it's the most common kind of stroke. It's when a blood vessel in the brain becomes blocked, and then one half of the brain does not get blood.
Go.
The second kind of stroke is called a hemorrhagic stroke, and it's when a blood vessel in the brain bursts, leaking blood into the brain.
Symptoms of stroke are easy to recognize. Just think about what would happen if a part of your brain was being destroyed by the second. The 5 common symptoms of stroke include numbness or weakness in the face, arms, or legs, confusion or trouble speaking, trouble with vision, dizziness or loss of coordination, and finally a sudden severe headache. Remember, time lost is brain lost. It is very important to recognize these symptoms early and take action immediately.
If you are a bystander of a possible stroke, keep FAST in mind. F is for face. Does one side of the face droop? And A is for arm. Does one arm droop? S is for speech. Does the patient have slurred speech?
It is a 中风 stroke.
And then T is for time. Time to call 911.
Here's what you need to do. If you experience a symptom of stroke, you're a bystander, you're seeing someone who's having a stroke, call 911 immediately. It emphasizes on time because every minute counts. And the victim of stroke should be carried in an ambulance only to an emergency department.
1 in 6 Americans will suffer a stroke after the age of 65. But don't let age statistics fool you. Stroke victims include a 41-year-old healthy fireman, a 22-year-old college athlete, a 29-year-old non-smoking vegetarian, and a 37-year-old musician. People of all ages can suffer from stroke. Stroke risk factors are clues that someone may be more likely to have a stroke. High cholesterol is a risk factor because plaques of cholesterol build up and clog the walls of the vessels in the brain. High blood pressure is a risk factor. There is an increased likelihood of stroke by 4 times. Atrial fibrillation allows blood to form hard clots that can travel up to the brain and clog a vessel. Circulation problems are a risk factor. Poor circulation lets the blood clot very easily. Smoking quadruples your smoke risk. Finally, stroke risks are twice as high for African Americans and Hispanic Americans. Getting help immediately after having a stroke is critical. There are some medications available that can help treat or prevent strokes. One of the medications is a thrombolytic called TPA, tissue plasminogen activator. It can unclog a vessel during a stroke, which can save someone's life and greatly decrease their chance of paralysis.
Wake ere the moment's come. Wake ere